So I want to talk to you this morning about three things: what we needed to do when we put our strategic plan together, what we've done to move that plan forward, and how we will sharpen our vision to create a new way of life for CHI and, more importantly, for the communities that we serve. I'm excited to talk about CHI and how this information will sharpen our vision in the next era of healthy communities and the next era of health care. CHI is well positioned for the future. This next era of health care is an unprecedented opportunity for CHI as we continue to expand our ministry. This is definitely what we're facing today. Economic incentives will shift to payment for value, not for volume. So we've been operating on a procedure, volume-based system, and we're going to have to move to one that will be paying us for value. We'll be rewarded for creating and maintaining the health of populations and caring for the people that we serve in our communities. The structure of our ministries must align with a focus on wellness and a focus on population health. At age 16, CHI has weathered a lot of change, a lot of issues, to become the leading organization that we are today. And one day, people will be looking back and talking about the people who took bold steps. Each and every one of us, all of our colleagues across the country, as we took those steps to lead forward, to move our vision forward. In the recent past, I know for myself and for many of you, they've been among the most challenging times that I can ever remember. I know many of you agree, and I know our leadership staff, we met earlier this week, we talked about how we can help our leaders cope with these changes. We've built 10 new greenfield and replacement hospitals over the past 5 years in CHI. In addition, we've acquired 8 hospitals, and we are approved over the course of the next 6 to 9 months to close on transactions that would allow us to add another 19 hospitals to our ministry. So we're continuing down a path of achieving more revenue from other than acute care services. And all of you know we have a destination metric that we've set to be able to continue to move the proportion of our net patient revenue to 65% outside the walls of acute care hospitals by the year 2020. When the plan was approved 3 years ago, we were at 48%, and today we stand at 53%. This allows us to provide quality care to more than 5 million residents and patients each year. Imagine that. Collectively, we touch and take care of over 5 million people each and every year across these United States. We did these things to move the ministry forward, to move our vision forward. We must continue to take bold steps like these in order to have the highest quality of care in the future. We need exceptional technology to make that happen. Now, we've refocused our capital spending plan in terms of the strategic direction for CHI. Just some 3 short years ago, we were spending collectively about 6% of our capital spend on IT and clinical information systems. 3 years ago, 6%. This year, our capital budget calls for a 37% of our capital spend will be in these areas. We all know that we have to bring the proper technologies to our caregivers so that they can provide the highest quality care for our patients. So it's real clear we will stay true to our mission. We will not turn away any patient that is in need of services that we provide. But in order to continue to nurture our mission, we have to work hard during the past years to offset this increase in the cost of care to those who we provide that are underserved and in need of our care. We have to continue to look at ways to reduce our expenses. We've been focusing on reducing those expenses on the administrative back office side of the equation so that we are not in a position and not in a need to be able to cut care at the bedside. So now looking at the third part, what do we do as we move forward? As we move forward, our mission continues to drive our strategic direction. The mission and culture help form the strategy. CHI's values-based decision-making process becomes even more important in the future as we continue to be faced with very difficult, very challenging decisions that we must make. We have a valuable lens through which to view the possibilities of CHI's future, the lens of our mission, which clarifies our duties and clarifies our responsibilities. Every act has the potential to transform the ordinary into the extraordinary. Every day in our healthcare, we have to be looking at ways to move forward to the healthcare delivery system of the future. This is how we'll translate our legacy into the future. The sisters, when they first came into the healthcare space in this country, they didn't set out to build hospitals. They came into communities to serve unmet needs, and those unmet needs led them to get into healthcare. Now we have an unprecedented opportunity to breathe new life into the work that the sisters began more than 125 years ago. Decades from now, people will look back at us and marvel at how we began to transform healthcare in a bold way in the spirit of our founders. Carrying our legacy into the future means holding fast to our mission while operating in very different ways. The emerging environment better aligns the CHI mission to improving the health of communities. This is our chance, this is our destiny to be able to translate the ministry and legacy into the future and advance the next era of healthy communities.